Hi guys, my name is Kunal and I'm one of the founders of MMI. I'm a 5th year medical student at UCL myself, and in today's video I'm going to talk about one of the most important topics in the news right now, which is the coronavirus, and it's something which is very likely to come up in any upcoming interviews you might have. So don't worry, I know the news can be quite a difficult thing to learn for your interview. A lot of the time students ask me and they stress because they probably haven't been watching the news every day for the last year or so, and in this 2 weeks that you have to prepare, you need to read as many articles as you can to try and make it seem like you're well read and knowledgeable. And I know it can be really tricky, but the main thing I'd advise is just to spend a good 10 to 15 minutes with each common news topic. And if you do that for a good 10 to 15 topics, you should come across as well read if any of these topics come up, or if they give you a more general question, you can bring in these topics to supplement an answer. So back to today's topic, coronavirus, and obviously this is a very deadly and very sad outbreak which has happened over the last few weeks. So obviously the information on coronavirus changes on a day-to-day basis. So I'm making this video on the 7th of February, and hopefully in the next few days or the weeks, the death toll doesn't rise too much and the whole picture improves. But obviously it's important to keep up to date beyond this video with what's been going on. Okay, so in today's video we're going to discuss a quick summary of the different aspects of coronavirus, and also do 3 MMI stations at the end, which are very realistic MMI stations which could easily come up in a similar fashion in your interview. So let's get cracking. The first question, or the first thing to discuss, is what is coronavirus? So obviously we've all heard about it in the news, but just to start off from basics, it's a respiratory virus, which means it affects your lungs predominantly before spreading to the rest of your body. And it leads to flu-like symptoms such as coughing, sneezing, and a sore throat. Obviously, you aren't medics yet, so in the interview they won't ask you too many specifics about the pathophysiology of the condition, but it's useful just to know roughly what the symptoms are. And as you probably heard, most of the cases have been in China, and it first broke out in the Chinese city of Wuhan. And since then, there have been many more cases across the world. Also, during this video, feel free just to pause the video after each question I ask and see if you can maybe answer with your own knowledge as if it was an interview question. So, the next question we're going to talk about, how many cases have there actually been? Well, there's been over 30,000 cases of coronavirus in China so far, and there's been spread across the world as well, but the majority of cases are in China. However, there's been only 650 deaths, which I say only, that's a very, very sad number. But the one positive we can take from coronavirus is that compared to previous diseases such as Sars, for example, the death percentage is not as high, which means that, let's say 30,000 people are infected with coronavirus, but 637 have died so far, which means that around 2% of individuals with the virus have died from it. So there is some encouragement compared to SARS in that aspect, and it's important to understand the difference between the number of people infected and the deaths. Obviously this could change by your interview, and it's quite useful, I would say, just to know the number of people who've died from coronavirus going into your interview on that day. Just a very rough number, just to show that you've kept up to date with the news. Because right now in the news, every day in the first 2 to 3 headlines there's an update on coronavirus. So it's really important just to keep up to date with it. Okay, so this slide is just going to show you how coronavirus has spread from China. And as we can see, it's over a few days, it's spread from Wuhan across many different Chinese cities. And obviously this is something which is very sad, but China's done an exceptional job to try to control the spread as well. So although there has been a very quick spread due to the separation and isolation, which we'll talk about in a little while, this spread has been limited greatly. And as we mentioned before, there's been many cases of coronavirus in other countries. So we talked about before that there's been 31,000 cases in China. So obviously the majority of cases are in China, and the numbers we see on screen are very, very small compared to the 31,000 in China. But as we can see, there has been some spread to places like Japan, Singapore, Thailand, etc. And even in the UK, there's been 3 cases. And I'll definitely recommend for your interview just to know a lot about the current state in the UK going into your interview. So, what are the symptoms of coronavirus? Well, as you mentioned before, it gives very non-specific symptoms. And you'll see this phrase bandied around a lot. So what does non-specific mean? Well, from a medical point of view, non-specific means that it's very difficult to relate those symptoms to a particular condition. So for example, if someone comes in with a sneeze, a headache, or a cough, it could be any of 100 different conditions, and therefore these symptoms are not specific. And that's the issue with coronavirus. A lot of the symptoms are very similar to the common cold, which means that it's very difficult to tell someone's got coronavirus until you've actually done some tests on them and cultured the organism just to make sure that they have got that particular virus in their blood. So what can be done to prevent transmission of coronavirus? And this is a very important public health concept, and something which could easily be an MMI station focusing on public health and how to reduce transmission of conditions in general. As a medical student, you learn many important skills about reducing infection. You learn a new way to wash your hands, for example. Like going into 4th year, I thought washing hands could be done in 10 seconds, but we learned a whole new 8-step technique to surgically wash your hands. And things like this you'll learn during medical school to try to reduce the number of bacteria on your hands and try to prevent transmission of diseases in the hospital and just in general in the public. So with coronavirus specifically, the NHS and the WHO have released many different tips on how to prevent transmission. So for example, you should obviously wash your hands, cover your nose when you sneeze, avoid contact with people with flu. If you eat any meat or eggs, you need to make sure you cook them properly. And additionally, you should minimize contact with farm animals or any wild animals. So obviously this is pretty standard stuff and stuff that you talk about for any condition, but it's important to know because you could easily have an MMI station where they perhaps have you talking to a patient who's worried about coronavirus or worried about a virus in general, and you could use these things as pointers and information to give out to the patient to try and reduce transmission or reduce the chance of them getting the condition. So next question, are face masks actually doing a good job in reducing transmission? So I'm sure you've seen in the news that a lot of people are wearing face masks, and actually there's a big shortage in China right now. So are these face masks doing any good? Well, Dr. David Carrington of St. George's in London said that the routine surgical masks that a lot of individuals are wearing are not actually that effective against transmission in the air. So viruses can spread in many different ways. They can spread when you cough or sneeze through droplets of water, or they might spread in the air, just floating around. So what this quote is essentially saying, and the general consensus, is that there are mixed reviews on face masks. They might reduce the transmission when you sneeze or you cough because you're less likely to get that droplet from someone else or give it to someone else, but they're unlikely to be a big barrier for viruses in the air. So there is still a very big chance of air transmission of the virus. How does the coronavirus compare to previous dangerous outbreaks? And again, I really recommend knowing a little bit about this for your interview, just understanding what Sars was, for example, and understanding how coronavirus compares to these previous conditions. So as we can see on screen, there's so many more coronavirus cases than, for example, SARS. However, the number of deaths is pretty similar. And that's going back to our original point, that around 2% of individuals with coronavirus actually get cured by it. So although the number of cases is higher, the number of deaths is quite similar. And obviously this might increase over time, and I really hope it doesn't, but one thing that we can take from having a look at these stats is that the death rate, or the number of individuals who are going to die with the condition, is quite low compared to SARS. So what's the incubation period of the virus? And think to yourself, do you know what incubation period means? If you do, that's really good. So essentially what it is, it's the time between you first being infected, and you might not know when that is, to when you first have your symptoms. So if incubation period is 1 day, it means that you only go through 1 day between being infected and having your first symptoms. Whereas if incubation period is 10 days, it's quite concerning, because a lot of us could be walking around with the virus, infected, but we don't show any signs, which means that we will give it to relatives, we'll give it to friends, and we can spread it around to many other people before we even realise we have the virus, and before we're treated for it and put into our own isolation. So with coronavirus, there have been mixed media reports. Some say it's around 2 days, some say it's around up to 10 days. So that's the rough incubation period, and it's just useful to understand how the incubation period impacts how easy it is to manage from a public health point of view. On to the next question. So why do these types of viruses come from places like China? And this is a very interesting question, and it's something related to the culture in terms of the animals they eat. So obviously no one has a definitive answer so far as to what coronavirus came from or why it came about, but there's many suspicions that it came from a food market in Wuhan, which was the city where it first broke out, and it came from people who were eating snakes. And in that market, people were eating all kinds of animals, snakes, bats, mice, etc. And SARS, for example, also came from China, and that originally, or apparently, came from bats, or the civet cat. So it's definitely a link, or there seems to be a very strong hint at a link between eating these wild animals and the spread of these kinds of viruses. And in some markets, the health and safety laws are not being adhered to. So therefore, even if the government is banning certain things or putting in laws in place, they aren't being followed well enough. So next question, is there a vaccine present? So right now, there's not currently a vaccine, but China have done very well, because as soon as they found the virus, they very quickly sequenced the genome, which meant that they could publish this to the WHO, and it meant that many different labs across the world could work to develop a vaccine. So I'm sure you know what a vaccine does, but if you don't, it's worth just looking up on that, just understanding how vaccines work and how they provide immunity to individuals. And this particular strain hasn't been seen in humans before, so that's why it's quite difficult, but they are looking to develop a vaccine. However, to develop a vaccine, putting it into testing and actually release it in mass production for use might take months and months, or even a year. So right now, when they treat patients, they're mainly trying to just treat the symptoms. So that's my very brief summary on coronavirus, and I really recommend that you read yourself on it and find out your own information as well. I've just breezed through some information I found online from watching the news and reading. So again, don't take my word as gospel, but it's just there to kind of give you an insight into the condition and some of the common questions around it. So now we'll move on to 3 MMI stations. And these stations, again, are the kind of stations you might expect if they ask about coronavirus in an MMI circuit. So the first station we'll move on to, and I'd really recommend pausing the video and perhaps talking out loud to give your answer, and then watching on to see what the mark scheme says. Or for example, just practicing it with a friend, or having a think in your own mind of roughly what you might say. This is all about practicing with MMIs. So take a second to pause the video and read the station. Okay, so first things first. For this kind of station, they're not mentioning the word coronavirus. And the reason that is that there isn't like a specification for an interview where you need to have known about a certain condition or a certain news article. So it's unlikely that they'll ever say to you, tell me about this article or tell me about this topic in the news. Instead, they're likely to give you maybe an article or some information about it, and the good candidates would know about that topic and bring in their external knowledge, whereas the other candidates who haven't read up still have a chance to have a fair go at the station. Or, for example, they could say to you, talk about an article you've read, and in that case they want you to at least have one example of a good article you've read. So here, if someone didn't know anything about coronavirus, they could still have a go at the station, but the best, or the good candidates at least, would bring in coronavirus and what they've read in the news and relate it to what's going on here. So let's go through some common points you can mention here. It's really important to think strategically, and you have to explain your ideas but also be time efficient. Let's say you have 5 minutes for the station. The interviewer might give you follow-up questions, so don't go in thinking that you'll have the full 5 minutes to yourself, because you might get cut off after 3 minutes and get asked a follow-up question. So when you make your points, it's good to explain them, but don't go on for too long. So the first point we could talk about is quarantining individuals infected. So here, for example, you could relate it to what's happening in Wuhan, and you could say that the individuals affected in Mexico City should be separated in a hospital where they can't spread the infection. And also, perhaps everyone in Mexico City should stay in their house and travel should be limited in and out. Secondly, we want to do some research into the disease. So the medical team need to find out the symptoms, the incubation period, and the route of transmission. And then this information can be given to the WHO to spread around the world so everyone is aware about how they as an individual can reduce the chance of getting the virus. Thirdly is sequencing the genome. So China were very, very quick in sequencing the genome of coronavirus. And what this means is essentially working out all the different genes and alleles present in the coronavirus, which means that it means that other labs around the world can start to make a vaccine against it and start to analyze how coronavirus works, its transmission, etc., and how to treat it. So that's something that's very, very important. Fourthly, release a briefing to worldwide media. So this is important as well. Obviously, the media can scare people and can cause panic, but it's important to release information out so there's clarity everywhere. If people are planning to travel to Mexico City next week, they might have to think again. But again, there's a lot of things to consider here, because if it's just a small outbreak which is going to be controlled within 3 days, then you don't want to ruin the tourism industry in Mexico City. So there's a lot to consider here. Fifth, invest in medical equipment. So, as you may have heard, China built a new hospital in, I think, 6 or 7 days, which is crazy. So that kind of investment was really good, because it meant that they could put all the coronavirus patients into one hospital and keep them safe there, or keep them isolated there. Sixth, find the source. So in China, they found that it was one particular street market where they think the virus broke out from. So in that sense, that obviously Wuhan's all been isolated now, but I'm sure that a lot of food markets across China and maybe in other neighbouring areas have stopped selling those kinds of animals, or people have stopped buying those animals. So in that sense, in Mexico City, we want to find out the source, which means that we can prevent more people being infected. And it's key to remember that you can either be infected from the source. So for example, let's say coronavirus came from a snake. You could be infected from the source by eating the snake, or infected by someone else via transmission. So there's 2 different ways of being infected. So we want to find the source and prevent that route. Sixth, quarantine the city. We've already talked about this. So related to Wuhan, shutting down places, reducing like public transport, the amount of people see each other, and essentially shutting down the city. And obviously this is quite difficult in the globalized world we live in, but something that Wuhan has managed, so it's definitely worth considering for Mexico City if the condition or if the spread is serious enough. And as you mentioned again, the possible travel ban to and from. And also we want to encourage good hygiene. So this relates to finding out how it's transmitted. So again here, if you know how coronavirus is transmitted, and if you give some insight into what the WHO is saying for coronavirus, you could always use it for the station. So for example, you could say, as head of WHO, I would want to ensure that we reduce transmission and we raise awareness. For example, for coronavirus recently, WHO released some guidelines such as telling people to wash their hands, reduce the amount of, if they cough, they want to cover their mouths, reduce the amount of meat they eat or eggs they eat which are cold, so make sure you properly cook them, etc. And if you give those examples relating to coronavirus and link it back to the case in Mexico City, you'll have the best answer possible. Also, you can develop treatment as well. So we talked about this, trying to find the best possible treatment, and the vaccine as well, which are two different things, because treatment is trying to treat individuals who already have the condition, and a vaccine is trying to prevent future people getting the condition. So that's a brief summary of some points you could say. There's many different things you could say here. The best thing I would say is to pick around 5 to 6 points and talk about them for around 10 to 15 seconds each and just give a bit of detail. But don't be too fixed on a particular thing. So don't say, for example, ban all travel in and out. You could say it could be potentially looked into, but we need to bear in mind the impact on the tourism industry, and also whether that's the ideal method or whether this is a severe enough infection. So there's all these different things to take into account. Now going on to station 2. So again, I recommend pausing the video and having a go yourself, okay? So this particular quote is quite a strong opinion and is relating to the source of coronavirus, which, as we just discussed before, is supposedly from a snake or an animal eaten at a particular food market in Wuhan. So when you approach this, you want to give some arguments for and against and give a balanced approach. Again, don't be scared to give your opinion, because you don't want to sit on the fence too much. You want to be an individual and have your own opinion, but again, don't be too strong either way. And again, you want to be careful of respecting other people's cultures and areas as well. So let's talk about some arguments for here. So if we banned the consumption of wild animals, it would reduce the risk of viruses. And you could back your point here factually by saying that coronavirus seems to have come from a snake, and perhaps SARS came from bats or cats. And you could mention these and say that if we stop eating these and if we put the ban in, then we could prevent future viruses occurring. Also, outbreaks impact the world. So even though you might say that China can make up its own laws, it's its own country, and they can decide what they want to do, it's more complex than that, because what happens in China affects the whole world. And as we've already seen with coronavirus, there's been many cases outside of China. So if a virus starts in a particular country, it's going to spread throughout the world. So it's definitely a worldwide matter. Another point is the poor hygiene in these markets or in these foods given out. So one might argue that instead of banning consumption of snakes and bats, you can just regulate it better, put better health standards in place, increase regulation on the quality. However, the hygiene just tends to be so poor regardless, and a lot of the time the laws are not followed. So for example, in Wuhan, there are reports of things being sold illegally, or the hygiene quality is not being met. So perhaps a worldwide ban would be a lot better, but it could be stronger and imposed, rather than putting in these health standards that often are not met. But then, on the other hand, you could say that even if you ban things, they might still be sold. So if people are going to sell these animals, you'd rather they sell them under government regulations and in the government market than via a black market, where things are regulated even worse, production might be a lot less official, and it can lead to even more conditions and more viruses and less checks being done. Also, it can be a slippery slope, because, for example, why should Chinese people, or anyone really, not be allowed to eat a snake and then someone else be allowed to eat a chicken? So it does lead to a fine margin where you're banning certain animals being eaten, and that hasn't been done before. So they can lead to a slippery slope. And who knows, in the future you could be banning all animals. If a condition outbreaks from chickens, will all chickens be banned in the world? So there is a slippery slope to think about here. Also, as we mentioned before, the laws may not stop things. So things will still be sold illegally, and as you mentioned before, this can create a black market. And this relates to many other debates that happen in the world. For example, legalizing marijuana. They say that by legalizing something like marijuana, you can, obviously it might increase the use, however you can regulate it, make sure it's safe, and educate people about it. Whereas by not legalizing it and keeping it illegal, there's a black market, and the black market can lead to poor products being delivered, which might be unsafe, and also it can lead to worse health problems as people aren't being educated properly, and also the government isn't getting tax revenue as well. And now, on to the final MMI station. Well done if you got this far into the video. I hope you've learned a lot so far, and let's apply it to the last station. And this is one of the role play stations, which can be really tricky. And I really recommend you practice as many of these as possible with friends or families or tutors if you have any. Because it's really difficult to just talk these out loud or just think about them in your head. It's difficult to know how to react when the patient becomes emotional or the questions they might ask you. So it's really important to practice and watch videos as well. We have some videos on our YouTube channel about role plays, and you can have a look at some. And if you want any tutoring, feel free to contact us, because we can always set up some Skype mock interviews with you. So, onto the station. And again, pause the video just to have a read, and then we'll crack on with the mark scheme. Okay, so with this particular station, Mrs. Thompson is quite assertive and quite sure of her opinions on coronavirus. And she wants to, or she's going to, withdraw all of her children from school. So she's obviously very, very concerned about coronavirus. And when you have your planning time or your thinking time, you want to just think about the first few things you're going to say and some points you're going to make. Because if you know how the first 30 seconds to a minute will go, it means that you'll start off confidently and you'll ease into the station nicely. Whereas if you go in stressing, then you'll start jumping to points and have no structure. So for this kind of station, I would begin by listening to her concerns and trying to find out what she's concerned about. And there's many different aims I want to get through in the 5 minutes I have. One, I'd want to explain what coronavirus is and give her some information. Two, I'd want to give her some tips on how her children can avoid getting it. Give her some tips on transmission and how it's spread from person to person. Third, I'd want to perhaps advise her that her measures are a little bit drastic and that maybe she shouldn't withdraw her children from the school because it's not a public health policy that's advised by the government. And four, I'd also want to be empathetic, show some time to show sympathy, give her some leaflets at the end, answer any questions she might have, and just work on the more emotional side to reduce the fear that she has. So those are my four main aims for this station. So I want to make sure that I time my station properly. And the actor might try to distract you. She might start breaking down about coronavirus and her dread of it. But that means that obviously you need to listen to her and you need to be empathetic, but at the same time you need to bear in mind what you need to get through in the station and don't get dragged to one side. So, first of all, you want to listen to her. Have a listen to what she wants to say. The actor will always guide you in the right direction, so they won't talk about things too much that will waste your time. Speak to her, and ultimately you want to advise her that her children should stay in school. It's probably best to do that after explaining what coronavirus is and reducing her fear, because once you reduce the fear, then you can give the final action or the final tip to her to let her children stay in school. So it's important to show some good knowledge first of all. Explain that coronavirus has only infected 3 people in the UK. Explain to her that coronavirus isn't high risk in the UK and currently it's low risk. Also explain to her how her children can be safe at school and reduce transmission by perhaps washing their hands carefully, also covering their mouths when they sneeze. If they feel more comfortable, they can wear masks. They can avoid eating uncooked meat, for example. Also be empathetic and show some ability to understand the concerns. It's really important not to just dismiss them and be too brash or be too sharp with her. You need to ease into things, and she obviously has a very big concern about coronavirus, so you need to understand the concern that she's having. And then finally, I would advise her to let her children stay in school. So you can go both ways in this argument. You might agree with her, but the government probably wouldn't allow you to withdraw your children from school for an extended period of time. And it's unlikely to be a sustainable action. So it's better for them to stay at school. And if it is unsafe at school, the WHO or the UK NHS would release some information about guidelines, and then perhaps there could be isolation within the UK as well. A bad answer would be to dismiss her concerns. You don't want to just throw away her concerns straight away and make her seem like she's being silly. You want to show awareness, and you might say to her, I understand why you might feel this way and why you might have these concerns, but my best recommendation to you would be X, Y, and Z. However, it's really important not to force your opinion, because at the end of the day, you're just her GP and you're here to give her advice. You can't force her to send her children to school. So therefore, you need to give your advice, but you shouldn't force it upon her. Also, in this station, it wouldn't look too good if you don't know anything about coronavirus. So if you just give a very generic answer, you could still score well, but it wouldn't impress the examiner as much. And it's really useful to bring in facts about coronavirus that you know from reading the news. So there you have it. That's my summary on coronavirus and a few MMI stations to finish off. I really hope you do well in your interview. And again, keep reading the news and feel free to comment on and ask any questions, and I'll definitely get back to you via there. So best of luck for your interview, and bye for now.
Thanks for watching. Click here to sign up for one-to-one tutoring with insider university knowledge, guaranteed improvement, and a personalized experience. Get your medicine offer today.